everyone. Today in this video series we are going to deal with a new pulmonary disorder called bronchial asthma. In this video series we are going to discuss about definition, causes, signs and symptoms, diagnosis and the management. Let's see what does the word mean asthma. Basically, asthma is derived from the Greek word which means chronic inflammation. Coming for definition of asthma, it is a type of disease in which bronchial airways become narrow and inflamed, which makes difficulty in breathing. Nothing but इधर क्या हुआ है bronchial airways narrow हुए हैं, inflamed हुए हैं due to many other causes and उसकी वजह से the person is feeling difficulty in breathing. With the help of this image, you can differentiate how the asthmatic airway differs with healthy airway. In the right side, you can see this is the airway. This is the healthy airway. You can see complete lumen and there is no excess mucus production. Okay, when we come to asthmatic airway, here due to thick mucus, excess mucus production, we can see there will be the swelling of airways and due to which there will be the obstruction and so that the person will feel difficulty in breathing. Coming to triggers. Based on triggers, we classified asthma into two types. One is extrinsic type of asthma, another one is intrinsic type of asthma. Extrinsic type of asthma can also be called as allergic asthma because see if the patient is having allergic to some things like particular allergic things like pollen grains, dust mites, pests, floor dust, etc. If the patient get exposed to any of them, then only he will feel or then only he will get the attack of asthma. And remember one thing, this extrinsic type of asthma having good prognosis and we can see extrinsic type of asthma in the patients who are having family history. Next coming for intrinsic asthma. Intrinsic asthma can also called as non-allergic type of asthma. Next one is viral infection. Viral infection is the main cause for intrinsic asthma. In that, rhinovirus is the most common, which can be seen in small infants. Other viral infections like enterovirus, coronavirus, etc. Cold air is also cause for intrinsic type of asthma. When patient get repeatedly exposed for a cold air, then he can get the episode of asthma. Next, medications like beta blockers, non-steroidal anti-inflammatory drugs. The complication of repeatedly taking of this medication, the person will get intrinsic type of asthma. Remember one thing that exposure to second-hand smoke increase the risk of asthma. ये second hand smoke मतलब क्या है? Okay, ये second hand smoke मतलब ये है कि we are taking the air which is coming from burning of tobacco like cigarettes, cigars, hookahs, etc. As we have seen, 80% of the patients will suffer with the respiratory disorders like COPD and asthma. It's because they are taking the tobacco. मतलब ये directly खुद ले रहे हैं. Okay, they are taking the cigarettes, cigars, hookahs, etc. But इधर second hand smoke मतलब ये है कि मेरे बाजू में बैठ के कोई tobacco burn कर रहा है and I am inhaling that air. Okay, indirectly I am taking tobacco. This is second hand smoke. Okay, and this will be the risk of asthma. Coming for symptoms of asthma, let's see what are the symptoms can be seen. Okay, first one is persistent dry cough. This is the most common symptom which can be seen in every asthmatic patient. Next one is shortness of breathing. It is because as there is obstruction in the airway, the person can't inhale and exhale easily. So he feels that there is a shortness of breathing and there will be the chest tightness. And here end expiratory wheezes. This is the main symptom which can only be seen in asthmatic patients. At the time of auscultation also, there will be the whistling sound can be seen in the lungs and there will be the frequent infection. So the asthmatic patients will have more prone towards the infections. Next, coming for diagnosis, how we can diagnose the asthma. It can be diagnosed by demonstration of reversible bronchoconstriction. How do you do this? This can be done by PFTs. It means pulmonary function test. It is the first line of test which can be done in every pulmonary disorder. This is performed with the help of spirometer. In this picture, you can see the person is asked to inhale through the nose and exhale through the mouth with the help of device called spirometer. In this, we are going to see FEV1 value, that is force expiratory volume in the first second. If the patient is affected with any pulmonary disorder, then we can see there will be the decrease in FEV1 value. Also, we can see there will be the decreased ratio of FEV1 and FVC values, which indicates force expiratory volume in the first second and force vital capacity. Remember and note one thing, that is asthma is episodic and reversible. What does it mean asthma is episodic? Means we can see the signs and symptoms of asthma for a certain period. Means episodically we can't see throughout every time. Okay. And reversible means with the help of proper treatment, we can elevate the symptoms of asthma. Means the patient can come to his normal position. Now we are going to learn how we are going to differentiate between COPD and asthma. See, one question will arise. Patient has come to you with the complaints of, sir or ma'am, sometimes I used to get shortness of breathing, chest congestion, dyspnea, etc. But when you go for the spirometer test, you will get, there will be the normal spirometer, that is FEV1 value is greater than 80%. Then how you are going to differentiate that whether he is suffering with COPD or asthma? Here, as I clear one thing, that is asthma is episodic, means when the patient was feeling the symptoms, that time he was got the episodes of asthma, but when he came to your clinic, then he was not having the episode of asthma. So with the help of a test called bronchodilator reversibility test, okay, what, how we are going to do this? We are going to give inhalation of albuterol 200 to 400 mg. It is a bronchodilator. So when we give this to a patient, it will dilate the bronchioles, okay, and which cause increase in 12% in FEV1 value. Okay, with the help of this test, we can differentiate episode of, sorry, asthma and COPD. Here, if the patient is inhaled this albuterol, in COPD we can't see any changes of bronchodilation. Okay, we can't see any increase in FEV1 value. But when we give to for asthma patient, there will be the increase in 12% of FEV1 value. Next, coming for classification of asthma. This classification of asthma is done according to National Asthma Education and Prevention Program. Basically, the asthma has classified into two types. One is intermittent type of asthma, another one is persistent asthma. Again, this persistent type of asthma is divided into mild persistent, moderate persistent, and severe persistent. See, classification of asthma is two types. One is intermittent and persistent. Again, persistent is divided into subclassification, mild persistent, moderate and severe persistent. Let's see the first classification of asthma, that is intermittent type of asthma. In this intermittent type of asthma, the symptoms like bronchoconstriction frequency will be less than 2 weeks. Means there will be the symptoms of bronchoconstriction will be less than per weeks can be seen. Next one is waking up because of symptoms less than 2 times per month. Means due to shortness of breathing in asthmatic patient, the person will wake up at night. In this intermittent type of asthma, due to shortness of breathing, the person will wake up at night less than 2 times per month. And use of short acting beta agonist drugs less than 2 days per week. And when we perform the lung function with the help of spirometer, we will get there will be the FEV1 value is greater than 80%. That is, force expiratory volume in the first second is greater than 80%, means which is absolutely normal. And we can also get there will be the normal FEV1 and FVC ratio, that is force expiratory volume in the first second and force vital capacity. Let's learn how to treat this intermittent type of asthma. First, what we have to do is we have to indicate short acting beta agonist inhalers, that is inhaled albuterol 90 mg per puff. Next one is 2 to 4 puffs as needed. As there is mild symptoms, we can give short acting beta agonist. As needed, 2 to 4 puffs can be indicated, and there is no need of daily therapy. So the treatment is easy. Just we can give short acting beta agonist as per the symptoms. As we completed what is meant by intermittent type of asthma and its treatment, let's begin for the second classification, that is persistent type of asthma, which is again divided into three types, that is mild persistent, moderate persistent and severe persistent. Let's see what are the symptoms can be seen in this reclassification. When we come for mild persistent, here we can see there will be the appearance of symptoms less than 2 weeks per week. Okay, waking up at night due to bronchoconstriction 3 to 4 times per month and with minor limitations. And when we go for spirometer test, we can see there will be the FEV1 test is greater than 80%. When we come for moderate persistent, here the symptoms can be seen daily and the person will wake up at night less than one time per week and some limitations. Here, when we go for spirometer test, here force expiratory volume in the first second will be around 60 to 80% predicted. When we come for severe persistent, here also we can see daily symptoms and waking up every night with extreme limitations, and the FEV1 value is also less than 60%. Here in all these three, see the symptoms will be less than 2 times per week. In moderate and severe, symptoms can be seen daily. Okay, here waking up at night, you should remember in this mild month. Okay, here week, and when we come for severe, every night. Okay, here 3 to 4 times per month, less than 1 time per week and every night. Here with minor limitation, with some limitations and extreme limitation. When we go for spirometer test, the FEV1 value will be 80% or greater than 80%, which is absolutely normal. When we go for moderate persistent, it will be around 60 to 80%, and in severe, it will be less than 60%. Let's see what are the treatment modalities which we are going to adopt in persistent type of asthma. First, in mild persistent, we can give daily therapy as a low dose of inhaled corticosteroids like budesonide and fluticasone. Okay, alternatively, leukotriene receptor antagonist like montelukast in adult we have to give in the 10 mg dose and in children 5 mg. Next, as a rescue therapy, we have to give short acting beta agonist. Okay. Next, coming for moderate persistent type of asthma. Here we have to adopt daily therapy, low dose of inhaled corticosteroids along with long acting beta agonist formoterol inhaler. Okay, in moderate persistent, we have to give the treatment in the daily therapy in the combination of inhaled corticosteroids along with long acting beta agonist. And as alternative therapy, we have to give inhaled corticosteroids like long-acting beta agonist, long-acting muscarinic antagonist, and leukotriene receptor antagonist. Next, coming for rescue therapy in the moderate persistent also, short-acting beta agonist can be given. Next, coming for severe persistent. Here, daily therapy will be given in the combination of inhaled corticosteroids, long-acting beta agonist along with long-acting muscarinic antagonist. So, inhaled corticosteroids like budesonide, long-acting beta agonist like formoterol, and long-acting muscarinic antagonist like tiotropium bromide. Here, if at all by this combination of drugs, if the asthma didn't come or did not control, then we can give combination of inhaled corticosteroids along with long acting beta agonist along with oral corticosteroids. So this we completed the bronchial asthma in detail. Thank you. We will meet in the next video.